We're going to move on to the examination of the posterior thorax now. Mary, may I examine your back?
Yes.
So we'll move to the back of the patient. And the first thing we need to do is maintain good modesty. Mary, may I undo your gown?
Yes.
So we're going to expose the area of the back that we need to examine. And I'm going to untie both the top and the bottom of the gown here, if I may.
Okay.
And then we're going to kind of roll the gown in just to be able to expose the portions of the back that I need to see for the examination. And the first step is examining the skin. And we're looking for skin lesions, moles, abnormal vessels, lesions of any kind. We're also examining for symmetries in the back. The next step is palpation. Mary, may I go ahead and touch your back now?
Mm-hmm.
So the first thing I'm going to do is just palpate the spinous processes. I'll often explain to the patient what I'm doing as I'm going, not just for comfort, but also so that they know what to expect. I'm palpating here for spasm, firmness, and other areas that might be tender, for example. The next I'm going to check the excursion of her lungs. And for this, I'm going to place my hands here with my thumbs at about the 10th rib. And Mary, I'm going to have you take a nice deep breath as I feel for the excursion of her lungs in a symmetric fashion to make sure that they're both working. And next we're going to move on to percussion of the back. This technique involves using the third finger of your hand and then tapping using the third finger of the other hand. You use a hammer motion with your hand to create a nice resonant sound. If you don't get a nice sound, you can lift your other fingers up off the back and extend your finger. And sometimes if you use both the first and third finger, you can get a very nice sound. And the hollow sound, of course, is air. And you're listening for consolidation that would sound more dull. You want to examine at least 4 different locations corresponding with the different quadrants and lobes of the lung. Next, we move on to auscultation. Mary, you're going to feel this nice cold stethoscope on your back now.
Okay.
I often take a moment to warm it up by just using a little friction with my hand. And then I'll place one hand on the shoulder and the other on the back with the stethoscope. Take some nice deep breaths with an open mouth. The open mouth allows for more clear sounds. I'll often say breathe big to get people to take a nice deep breath. And you sometimes have to remind them to inhale and exhale. Otherwise, they hold their breath. I'm listening for clear lung sounds or crackles or rough sounds that could indicate abnormalities. I'm listening with the diaphragm, as you can see. And you listen in a minimum of 4 locations corresponding to the various lobes of the lung. We're now going to move to the examination of the anterior thorax. Mary, may I untie your gown here?
Yes.
And again, the first step is to expose the portion of the body that we're going to examine. But here we need to have great care with modesty to keep her well covered. Mary, would you be able to lift your hand up and just hold that gown there so that it keeps you covered? And then the first step is inspection. And again, I'm looking at the skin, and I'm looking for skin lesions. I'm looking for symmetries or asymmetries involving the clavicles, the front of the neck, and the chest. And then I will percuss, and so we're going to use that same technique that we used on the back to listen for areas of consolidation. And then next we auscultate. So Mary, I'm again going to put this nice cold stethoscope on you.
Okay.
And take a nice deep breath, if you would, with an open mouth. Very good. And examination of the lower portions of the anterior chest can be done also during the cardiovascular examination, which is the next portion. We're going to move to the examination of the cardiovascular system. In order to do this, we're going to ask our patient to lie down at about a 45-degree angle. So I've placed the table here at 45 degrees. Mary, would you go ahead and lie back down? And while you lie down, I'm going to extend the footrest. And the first step is going to be examination of the carotid. So I'm going to inspect her neck and look for carotid pulsations that you may see here across the anterior neck. And then I'll palpate the carotid pulse using 2 fingers placed very gently across the anterior portion of the sternocleidomastoid. Sometimes you need to move your fingers around to find the pulse. You always do just one side at a time. Okay.